What if I told you your company is probably overpaying for healthcare by about
Okay. All right. Let's get into this before we get a little bit more sidetracked. Donovan, welcome to the show. And I have to start here. You spent a decade as a professional drummer in Memphis. You've opened for Hurt, and now you're a health insurance whistleblower. How does that happen?
Great question. So, yes, I spent just about 10 years playing drums full time in New York City throughout my 20s. Great experience, great thing to do when you're young. So, basically, what happened was towards the tail end of my career, I was touring with the bands nationally. We got signed to EMI, recorded our debut record for EMI out in Sonic Ranch Studios in El Paso, Texas, which was amazing. And then before the album was even finished, EMI went bankrupt and we were done. And, I was 31 years old. I said, you know what? It's been a great run, but I'm getting really sick of, going to bed at 6 a.m. I want a completely different life experience. Got other problems I want to solve and things I want to do and parts of my brain that I want to use. And so I said, what's the most opposite life experience from being a full-time musician? Well, this insurance thing, I don't know anything about it, but I know people need it and they don't understand it. Let me just dive in and see what it's all about. And somehow convinced one of the biggest insurance companies in the world to hire me with no experience, and went from there.
So, can you tell me how the whistleblower came about of that? After the insurance gig, you must have spent a while learning the system.
Yeah, exactly. So I've seen the healthcare crisis from many sides of the spectrum. First, yes, again, working at a large insurance company where benefits brokers were my customers, and then I jumped the fence. I was inspired by the work of Harris Rosen here in Orlando, who was the founder of Rosen Hotels. Figured out really interesting ways to save his company over $500 million on healthcare over the last 30 years. I thought that was really inspiring. And I very naively thought, geez, if I just went and worked for the transition over to the brokerage side of the industry, I can probably scale those kinds of solutions, probably make some money and help some people doing it. And I quickly realized that that's not how it works.
Very fair. So you're called the situation like the fox down in the henhouse. What did you do when you discovered that? I'm sorry, got the question here. I'm just waiting. What did you discover when you worked on both the carrier and the brokerage sides of the industry?
Yeah. So just to level set for your audience, here in America, US businesses cover 164 million Americans with healthcare benefits. And at the end of the day, most CFOs, most HR professionals have virtually no technical training in healthcare financing or procurement. And so what they do is they rely on outside experts, and that's fine. You do that in all kinds of different parts of business, right? Whether it's taxes, with legal services, et cetera, you outsource it, right? And that's very natural. But what's unique in the benefits and healthcare industry is that, employers rely on benefits brokers. When they think that benefits brokers their job is to give them financial advice on how to maximize the return on their healthcare investment. We're going to spend all this money. How do we know we're getting the most value? Well, if you understand the supply chain, you'll come to realize, and if you read my book, you'll definitely realize and understand that brokers are not in the business of maximizing the return on healthcare investments. They're not in the business of giving financial advice. That's not what they do. They are supply side vendors. The industry was created to sell insurance products for insurance carriers. That's what they do. And that's all good and fine. There's nothing wrong with selling insurance. But what the problem is that if they market themselves as independent consultants, but they're actually getting paid all these kickbacks from pharmacy benefit managers and insurance companies, then they're basically serving as what I call double agents, right? And so you think they're working for you, but they're actually working for the other side. And that's a big problem, especially when you're talking about your second largest expense.
It's one of the things actually I see a lot in government as well is that people double pay all the time because the opportunity's there, so they might as well. How did that become part of the system?
Wow. Well, let's go down memory road here. And yeah, just to level set for your audience, I think this, if for people that are business minded, this is actually pretty fascinating. People in modern day, we think that health insurers and hospitals kind of have this antagonistic type relationship. They sit on opposite sides of the table. But in reality, that's not true at all. During the 1930s, during the Great Depression, hospitals were having a very difficult time maintaining their revenues and having stable revenue. And so it's a hospital in Dallas, Texas had the brilliant idea. What if we got a large employer to prepay for our hospital services? And so they ended up partnering with the Dallas Teachers Union. And for 50 cents per employee per month, these teachers could come to this nice, clean hospital and deliver their babies. And so that really helped to save Delaware University Hospital and stabilize their revenues. And here's the fascinating thing. Over the next 10 years, hospital executives from around the country took note of this and they said, wow, well, how can we develop our own prepaid plan so we can stabilize our revenue? And so these hospitals actually put up the seed money to found health insurers across the country. By 1960, there were 700 health insurers in the United States. I mean, just fascinating. And so at the end of the day, health insurers are simply distribution partners for hospital services at the wholesale level. Now, here's what happened. Just up until the federal minimum wage laws went into effect in 1938, most of these health insurers had in-house sales forces, right? They were W-2 employees that went around door to door, which was common in the time, and sold policies. And that's all good and fine. So, but when the federal minimum wage laws went into effect, they said, wow, this presents a problem. I don't want to have to pay these salespeople, who half of which don't even sell enough for us to even warrant of paying them a minimum wage. So what we're going to do is we're going to reclassify them as independent contractors. Okay. Makes sense. Makes perfect sense. But what that did was it allowed these independent salespeople to not only sell one insurance company's products, but now they could sell multiple insurers' products and collect commissions from each of them. That was their job, was to sell products. And that's all good and fine. But in today's day and age, what businesses are looking for, they expect their outside consultants to help them maximize the return on their investment. Oftentimes that involves not buying products. That involves self-insuring, not buying products, right? 60% of Americans are on self-insured health plans. Okay. So it's the employer that takes on the risk. And so there's a whole lot behind this, but at the end of the day, delegating the management of your healthcare supply chain to insurance companies and brokers who financially benefit from your pain, they make more money when costs go up, not down. That does not work. And that's why we're seeing so much waste in this system to the tune of $325 billion a year in the employer market.
Largely due to waste.
It's insane how much ballooning it has done over the years in that market. So let's get into a little bit more of the solution. So you're saying that you can save about $4,000 per employee.
Healthcare system.
So for a company with about 100 employees, that's $400,000 annually.
Yeah.
Where is all that money going? Is it just going into people's pockets?
Yes. How is the waste happening? Basically, yes. When we talk about the Foxguard and the Henhouse, the double agent, these employers, since they don't understand this space, they rely on their broker to recommend vendors to them. Like, who's the best pharmacy benefit manager for us? And so what they ended up doing is just kind of blindly going with whoever the broker recommends, because they don't understand this stuff. And so if your broker is recommending vendors whose business model and financial interests are diametrically opposed to yours, that's a problem. So, like, for example, you end up paying $80,000 for Humira or any of these specialty drugs that you can get for $35,000, or in some cases you can get it for free. So there's all kinds of opportunities out there, but it starts with just getting unbiased advice. We don't need some technological advancement. We don't need some kind of nirvana moments. It's just simple stuff. You have to make sure that you're getting unbiased advice. That unlocks all of these productivity and economic gains.
Very fair. I think the system is starting to get more towards helping as opposed to taking. And I've been feeling it, at least across the spectrum, that we're getting more into a society that wants to help as opposed to take away. Let's hope
Yeah.
that continues.
Well, yeah. And it's really, I think one of the movements that we're seeing is that one of the things that technology has helped with and media has helped with is transparency.
Mhm.
If you're a bad actor, you can't, in a capitalist society, it's win-win or no deal, right? That's win-win or no deal. And you can do it anything you want as long as you don't hurt somebody, right? That's like the core essence of it. But what we're seeing, what we've experienced because of a lack of transparency over many decades is that we've got a bunch of companies out there who are not aligning their incentives to actually solve problems. And so it's not a win-win or no deal. It's one party wins, one party loses. And so that's not sustainable and it's not right. So I think it's inherent that we have the pendulum fluctuates in this way, but it's just, I think it's, to your point, it's starting to swing back to the way that it needs to be.
So your company, Health Compass, operates on a fiduciary based model. What does that mean and how is it different?
Yeah, great question. So when companies are marketing and they're talking about their business and creating ads, they can almost say whatever they want, right? I mean,
Yeah.
but what really matters is the contract, right? Contracts are hugely important in free societies because it's a written agreement about who's going to do what and who's going to pay who and the terms of the deal, right? And so the term fiduciary is a legal term. And so you want to get unbiased advice. One of the ways that you can do that is by hiring an external management consultant firm like Health Compass. There's a number of us in the marketplace. I'd encourage you to look at them. But in their contract, it has to say that they serve as a fiduciary to you. They have to act in your best interests. That's a big deal because you don't know any of this stuff. Otherwise, you end up working with, to use a metaphor, working with a CPA who gets paid by the IRS. That doesn't make any sense. And just stop doing that. Otherwise, you're going to end up paying for healthcare by over $4,000 per employee per year. Totally unnecessary. So you got to have a contract and it's got to say that the management consulting firm embraces and serves as a fiduciary to you. That's the legal term that you need to have in there. Otherwise, you just don't know.
The nice part is you can just throw those contracts to AI now and you check to see if it's in there.
Isn't that nice?
Yes. I actually, at one point, I was debating on building that just lets you analyze a contract, but then I just kind of lost track. That's kind of what I do. I come up with good ideas and then never done them.
Well, there's lots of distractions these days, so you're not alone.
So can you share a quick success story with us?
Yeah, absolutely. So, a few years ago, we got a call from the executive director at a local teachers union, Seminole Education Association. And, they said, listen, we've never met. And I didn't even know they existed at the time. But they said, we have some of our union members sitting on this insurance committee and, they're smart people, but they don't know this insurance stuff. And they're being asked to make decisions about the $65 million healthcare budget. And, we just don't even know what we should be pushing for, but we know our costs are just skyrocketing and nobody can afford it. Like some of our teachers are literally on food stamps.
Yeah.
So can you just come in and tell us what we don't know? Because we don't really know if we trust their district. We don't really know if we trust the broker. So we came in, our first engagement was just to educate them on the landscape. Who does what and why? Why do these vendors exist? Now they can just read my book and get all that information. And then they said, okay, that's great. That's super helpful. Now, can you do a deep dive on our health plan itself, the vendor stack inside of it? Tell us what's the low hanging fruit? What should we be pushing for in these monthly committee meetings? Because really, we don't feel like we're getting anywhere. And so we did an analysis and it turned out that, they hadn't done the RFP for a new pharmacy benefit manager in 7 years. And your pharmacy benefit manager, there's a lot of talk about them in the news for good reason. Many of them are under investigation from the FTC, the DOJ. So there's a lot of noise about them right now. But it turned out that they were, they had been using the same one for 7 years. And by the way, they were with one of them who actually runs away from fiduciary responsibility. right? Their
Mhm.
business model was to actually just mark up the price of drugs by undisclosed amounts. They'd walk into a meeting and say, listen, our services are free. We just mark up the price of the drugs and so our service is free. Like, they'll get buried in that, right? No. So we said, listen, push for a new pharmacy benefit manager, to start the RFP process. So they did that. They got 11 responses. They went with one, which, we think was kind of in the middle of the pack, but whatever, better than the one they had. They saved about $3.6 million last year on drugs just by swapping out one vendor. There was zero impact to the membership, right? To the employees and their dependents. I mean, this is low hanging fruit, but if you're not getting unbiased advice, you're never going to get those kinds of recommendations. And so that's, just one example. I could go on and on.
No, it's good because this kind of showcases there is a lot of money to be. People don't know because it goes along with all of like even internet. Everything's black box, and that's what we're trying to fight against.
100%, Cody, and it's been so great. I don't know if you've been watching, but it's been so wonderful having someone like Mark Cuban get really passionate about this area. And
with the
you've
US
got one of my
spending
favorite quotes, which
more
is,
than other
where
wealthy
there's
countries
mystery,
on billing
there's
and claims.
margin. And it's
Prescription
true
drug
in
prices
healthcare.
also
It's true
contribute
in any
significantly.
industry.
With the US
If you
spending
don't, and there's a
far more
version,
on
what we're
retail
talking about
drugs
today,
than
like
other
there's a
nations.
version of this in every
Wasteful
industry,
clinical
right?
care,
But it just so
including
happens that
unnecessary
healthcare is 20% of our GDP and the fastest growing financial risk in corporate P&Ls. So we should probably pay attention to this. So, but it's just been great having someone like Mark Cuban really dive in, make some noise about it.
I'm really hoping because
He's the
I've
CEO
heard
of
rumors
Health
of Trump now
Consulting,
trying to do something
author of
similar. So I'm
Fixing
just kind of
Healthcare,
hoping that
and named
Mark Cuban doesn't
2025
push out by
Benefits
whatever
Advisor of the
is
Year.
coming in.
Donovan
Well,
advises
so we can talk about
executives
that for
on
a sec. Who
healthcare
knows if Trump will
complexities,
actually be able to execute?
emphasizing
He says a lot of things
transparency
that don't
and
actually come to
cost-effectiveness.
fruition.
He's
But
here to
so
expose what
basically,
he
I
calls
think the press
fox
release
guarding
was
the
basically to the
henhouse,
effect that he cut a deal with
$300
Pfizer,
billion problem
which is
hiding in
Pfizer
plain
controls about
sight.
20% of the market.
Addressing this
And
requires a
so consumers
collaborative
can
effort
buy
from
drugs directly
employers,
from this
policymakers,
government
and
website, which I
providers,
have
implementing
issue with.
cost-effective strategies.
On principle alone,
This includes
okay,
choosing
that's all good and
cost-effective health
fine, but
plans,
that's not
leveraging virtual
most.
healthcare,
That's
and
maybe
promoting
3% of the
preventative
population
care
that's
and
buying
mental health
things
benefits.
routinely
If you're a
out of
business
pocket,
owner,
paying
this
cash for them. I happen to
conversation
be
could
one of
save
them.
you
I actually don't even
thousands
buy
per
health
employee
insurance.
and
I
change
just
how you think about
pay
healthcare
cash for healthcare,
forever.
like
By
everything else.
understanding these
Yeah,
issues
so
and
it's
implementing solutions,
the intent is there. I
businesses can
think he's definitely
contribute to
trying
a
to
more
help the situation,
sustainable
but
healthcare
the way he's
system.
going about it,
Let's
I don't
dive
think it's
in.
actually going to do anything.
At some point, I wouldn't mind picking your brain on cost cash versus having a plan, but that's a
Let's do it.
different.
No, let's do it right now because we can talk, have this conversation like very quickly.
All right. So yeah, like
We
the
don't have to
system,
speculate.
I know
Yeah,
the
exactly.
system is actually beneficial to cash over plans. Can you explain why that discrepancy is there?
Sure. So let's just level set for the audience. In the current state of things, and this is according to Rand, fantastic Rand study from, I think it was 2019, basically said, listen, anyone who walks in off the street and pays cash for healthcare, by and large, gets a better deal than the negotiated rate that the biggest health insurers in the world have negotiated with hospitals and healthcare providers. And your question is, so in other words, if you pay cash for services outside of your health plan, the unit price of that hospitalization, surgery, lab, imaging, or drug is going to be less than what the health insurer has negotiated. So this is profound, right? I mean, how could it be? Like, why aren't these health insurers, aren't they supposed to manage these supply chains and provide more value for their members? No, that's not what they do at all. No, because again, they are distribution partners for hospitals and now drug makers, because now they've all vertically integrated. They own the pharmacy benefit manager. They're buying the physician groups. They're creating their own group purchasing organizations, GPOs, where they actually sell the surgical materials and instruments to the hospitals. They're monopolizing
pocket is none.
Yes, monopolizing the whole supply chain. And here's why. Because under the when we talk about healthcare, this is one thing that's challenging about talking about this topic in this industry, is that you can't make general statements, because the commercial marketplace is very different from Medicare, which is very different from Medicaid. And those are the big three distribution channels in the United States. My expertise is in the commercial marketplace, which covers 164 million Americans, about half the population. So let's talk about that. So in the commercial marketplace, where if you go and pay cash, you're going to get a better deal than the biggest insurance companies in the country. Why is that? In the commercial marketplace, health insurers make more money when their cost basis goes up. So under the Affordable Care Act, which was this landmark legislation in the United States, went into effect in 2014, basically said, listen, here was the pitch to the citizens. These health insurers, here's what the legislator said. These health insurance companies are making too much money. Here's what we're going to do. We're going to cap their margins. This sounds like a great consumer protection, right? Basically, what it says is out of 85 cents on every premium dollar has to be spent on healthcare, meaning medical claims and prescription drugs, has to be spent on those things. If you don't spend 85 cents on every premium dollar on those things, you got to refund the difference back to the employer, who refunds it back to the employees, yada, yada. Sounds wonderful. Thank you, government. What an amazing consumer protection. You're so great. Thank you. Here's what the insurance companies said, because they're very smart, is that you want to cap our margins. Here's what we're going to do. We're going to vertically integrate. We're going to buy up the rest of the healthcare supply chain. We're going to buy the pharmacy benefit managers. We're going to buy the physician groups, and we're going to sell all the materials to the hospitals. Okay. So what does that mean? Right now, fast forward, from 2014, 11 years, 2025. Now, if you listen to the quarterly earnings reports of these publicly traded health insurers, most of their their profits are actually coming from the sale of drugs. Okay. It's like health insurance is almost a loss leader to sell drugs, because that's where the real money is. It's on the supply side. Okay. It's not about helping employers, mitigate their costs. That's bozo work that people like me do. The real money is on the supply side. So it's much easier to make money on that selling drugs and selling the services and marking up the price of those services. That's the situation that we're in. And this is why I wrote the book, because as a CFO, if you don't know these things, how can you possibly navigate this environment? It's complex. I mean, I feel bad. I feel bad for our customers because it's so complex. I really do. And we do our best to educate them. We try to make it as simple as possible, yada, yada. But at the end of the day, I mean, even when you have someone sitting on your side of the table, it's still hard, right? But imagine, they get frustrated. A lot of executives we find have kind of left the conversation because they're like, well, we've been told that healthcare costs just go up every year. There's not a whole lot we can do about it. And if there's nothing I can really do about it, I don't need to be in this meeting anymore. And I don't feel like I'm getting clarity from my broker, but it is what it is. Everybody uses brokers. So HR, you just deal with it. And so that's the situation that we're in. And I hope that answers your question.
It does. Thank you for going into that. Sorry.
That rants.
It's all good, because I know I have a lot of knowledge in various aspects. So sometimes when I have something, I think I remember that from like a John Oliver episode that I was talking about PBMs or something like that. That's where that came from. But it's good to enlighten other people, because transparency is what we need. So with the last 5 minutes, I do have a couple questions that I just want to get into. So what are some red flags people should look for when they're dealing with their current broker?
Yeah. So in the small and mid market, you'd be amazed how many employers don't even have a contract with their broker. And there's a very good reason for that, because the broker doesn't work for them. That's why they don't have a contract with them. Right? So you need to have a contract, because essentially it's like to actually manage your program well and compliantly. There's a lot of services that go into that, to managing a health and welfare program effectively. And so a lot of employers rely on their broker to provide these services, even though brokers, for the most part, just get paid to sell products. So it's kind of this, mismatch here. So again, contracts are super important, because it will actually clarify, here's what your broker does, and here's what you have to do, and here's how your broker gets paid. And so awareness is the first step there. And so that really helps to improve the operation of your program, because you know who's doing what and when. And so that's hugely important. Second big piece is understanding how they get paid. And actually, under federal law, starting in 2022, you are, as an employer, you are required to know exactly how your broker gets paid, so that you can fulfill your fiduciary responsibilities under federal law. So you're supposed to be getting this thing called a 408 disclosure, and it outlines not only the direct compensation that they're getting paid in commissions from the carrier, but also the indirect compensation. And this is really the pernicious part, because when I was working on for a huge insurance company, as I worked my way up through the ladder, one of my scopes of my job was to actually design the bonus programs for our top selling brokers. I was literally flying these guys around the world on luxury vacations to reward them and incentivize out of the goodness of my heart, but because we wanted to make sure they recommended our products over our competitors. It's simple as that. No one thought anything about it. It was just the way business is done. So you got to understand the compensation structure and to understand if they're a double agent or not.
Very fair. Thank you for that insight. Could you have one final question before I leave it to you to plug everything? If you have a magic wand, fix healthcare tomorrow, or fix one thing about healthcare tomorrow, what would it be?
One thing, let's talk about a private sector thing. The argument I make in my book is that actually the private sector, the employers who have tons of power and can actually really improve what's happening in this area, but they have to be aware. Awareness is the first step. They have to get unbiased advice. I outline in the book a 6-step process for healthcare transformation. Unbiased advice is the first step because it unlocks everything else. And I'll leave it right there.
Knowledge is power. So thank you very much. Where can people find you? Where can people connect with you? And what do you have next?
Sure. I'm all over LinkedIn and X, for better or worse. People can certainly go to fixinghealthcare.com, sign up for it. Right now, the book doesn't come out till November 12th. But in the meantime, you can sign up for an executive summary of the book. And we created that summary for executives who are time poor and just need to get the core concepts quickly. So it's a really quick PDF, and you can really, just make those improvements just off of that. So I'd encourage you to go to fixinghealthcare.com and sign up for that.
And I'll make sure all that information is in the description below. Thank you very much for enlightening my audience, and I hope it helps. I hope it helps everybody out there. Thank you very much, and stay weird.
Okay. Thanks, Cody.
But I'm from a small town, and I built mine with code, coffee, and chaos. Just a coder from the coast with too much to say. Watch the suits in Ottawa lose their way. They build red tape, I build escape, turning loopholes into lemonade. PowerPoints, pipelines, policies spin. They say stay quiet, I say dig in. Cause when the system's slow, I make it mine. One line of code at a time. They said keep calm, follow the plan, but weird's the way I understand. We don't need millions or fancy degrees, just Wi-Fi, coffee, and a dream that breathes. I'm the weird Canadian.